Assalamualaikum and very good evening to our madam and all my friends in DM1A. My name is Muhd Izzul Hisyam bin Zuhaimi. My metric number is 09DEM20F2022. Today I will be presenting about juvenile idiopathic arthritis or JIA. JIA is a very rare disease that only attack a minor below 16-year-old. For your information, me myself is a juvenile idiopathic arthritis survivor, and I have to live in this situation almost 11 years until now. So I think this topic will be interesting. We'll be presenting. To the next slide. The second slide is objective. My objective is to educate people that healthy is everything and to make people know about arthritis, especially juvenile idiopathic arthritis. For your information, there are a few people that truly know about this arthritis, and this arthritis have many types. One of the type is polyarthritis. Polyarthritis can be cured at any ages. Usually, the patient have to suffer swollen joints and difficulty to move around like normal people. So CIA will be last for a month, a year, or entirely the whole life of the patient. And in my case, I will suffer this disease for my whole life. So to the next slide. The third slide is 5 things you should know about GIA. The first thing is body immune system. Juvenile idiopathic arthritis is usually an autoimmune disorder. Because of the autoimmune disorder, we have a bit difficult to recover from injuries and skin damage. The second thing is chemotherapy. As a GIA survivor, we do take chemotherapy like a cancer survivor, and it will be the most difficult thing in my life to handle the chemotherapy because I can't eat properly and do anything I want because of the chemotherapy. The next thing is bone marrow biopsy. In order to diagnose us for this disease is we have to go through bone marrow biopsy. The doctor do the bone marrow biopsy because they want to make sure that we have abnormal blood cell in our blood, either white blood cell or red blood cell in our platelet. So the next thing is 1 year or the whole life. So the GIA survivor need to survive this disease for a month, a year, or in other cases for the whole life. In my case, is I need to go through this disease for my whole life, so it will be a difficult thing for me. The next point is 1 year or the whole life. As a GIA survivor, we need to survive this disease for 1 year or the whole life. So in my case, I need to go through this disease for my entire life. So it will be difficult to me to handle this disease. The last thing is affect bone development. GIA survivor have to get through this, and we can get any taller or growing like a normal children and have a normal adult body like others. And we need to get through this in our whole life. So it might be the most difficult thing for us. For conclusion, I hope everyone will take care of their health and care about disease, especially those involving bones and joints, because bones and joints are very important to us. We use them to do a lot of stuff and to live our life well. So we want to use them for a long time. And for your information, I had this disease for 11 years now, so I think I can get used to it. And I hope all of you can learn something from my presentation. And I hope this presenting will give you some information about arthritis or juvenile idiopathic arthritis especially. So the picture on the right side is actually me giving my injection at Ustaz Dayang, and that's all from me. Thank you very much.